wonder if that's me. Let me see a Raytech, please. Okay, we're just getting started on your left shoulder, looking in from the back to the front. There's the rotator cuff tear right there. We're going to take a #1 PDS and use it as a marker stitch so we can find that torn rotator cuff on the other side. There's some torn tissue here, and I'm trying to see if that's biceps tendon. I'm going to use this as a probe. And so as we tug down on this, it looks like it's labral tissue. Yeah, it's labral tissue. See that? It's not biceps. So we'll look at the biceps anchor. We'll see if this is solid. That actually looks pretty good to me. So you just tore some of the labrum, but not the biceps anchor, at least not enough to have to do a tenodesis, I don't think. We're going to look a little bit more at that. I may still do that just to be safe. Pause. I probably should do it. Okay, so we're looking around the rest of the joint. We've got a little bit of water in the scope. We're going to go off on the video and just dry it out a little bit. Okay, so this is the posterior aspect of the joint. It looks just fine. I don't see any significant arthritis. And here's the anterior aspect. It also looks fine. We are going to do a biceps tenodesis, so hold the camera there. We're going to go ahead and pass a spinal needle through the biceps tendon here in just a second. You'll see that on the screen. There's our first pass. We'll show you some more in a little bit. Pause. Okay, pull the spinal. Okay, so here's the tear in the rotator cuff. We just finished tenodesing the biceps. And now we're going to go ahead and take the guide for the anchor and place one triple loaded suture anchor right down here. So there's the guide. You can see that's going down into the joint. We'll go ahead and pull that and place our anchor right there. Okay, so we've got our anchor in good position here, just off the articular margin. We're going to take one of these sutures first. Now we're just going to get to stitching this back together. Okay, so we're all done. You can see the repair. There's one suture there, a second suture, and a third suture. So that tear is completely healed. Not healed, I'm sorry, repaired. That would be a good trick if I get it to heal right now. But so we're going to go ahead and make a little hole in the bone here. Go ahead. Yep, that opens up the marrow space and helps out in the healing process, I think. And if there's room, we'll do one more. Maybe back here. Yep. Okay. Okay, so that's it. That looks great. Everything's moving together as a unit. I'm happy with that look. And we're going to get you back to the recovery room shortly, okay? Good luck to you now. Bye-bye.